Thomas. I'm the administrator of the Washington County Health Department located in Fayetteville. So I'm going to talk today about reentry. And beginning with that discussion, I do want to share what our local health unit does in Fayetteville, because I often hear that people are not aware of what we do. So the services that we provide are outbreak services such as COVID, traditionally flu, some of the other things we cover, but we do cover outbreaks in the community. We also have environmental services with food inspections, pool inspections, septic inspections. We offer family planning services, immunizations for children up to age 18. We also offer limited immunizations for adults, and that includes flu and Tdap. We offer maternity services, vital record services. So if you're needing a birth or death certificates, we offer that in our local health unit. And we also provide women, infant, and children nutrition programs, otherwise known as WIC, to the community. So for reentry, these are the things that you need to consider when you're re-entering the public again. So we do need to make sure everyone is washing their hands, that they're physical distancing from each other, they're wearing a cloth face covering, and they get tested if needed. So we'll start with washing our hands. And I know many people have seen the videos that they've put online or that they've shown on our local news stations, but we need to wash our hands often with soap and water for at least 20 seconds. So many people have turned this into a fun activity by adding a song that they sing either out loud or in their heads, but you need to watch your time and make sure you're at least washing your hands under the water with soap for at least 20 seconds. And if that's not available, you can use a hand sanitizer. Just make sure your hand sanitizer, contains alcohol in it so that it is cleaning your hands well. With social distancing, this is something new that the governor has talked about daily in his updates to the community. And so what we need to make sure that we're doing is avoiding close contact with others, especially those who are sick, by keeping at least 6 feet between you and others. And then it's suggested that you limit going out except to get medical care. If you think you've been exposed to COVID and you develop these symptoms of fever, cough, shortness of breath, talk to your doctor about that, and your physician will decide if you need to be tested based upon your symptoms or your known exposures. And then lastly, we're all encouraged to wear a mask in public now. So wearing a cloth mask when in public and you're unable to maintain a 6-foot distance from others is helpful, because it's not necessarily preventing you from catching the illness from others around you. But we do know that COVID can present itself in people without symptoms. So you may have COVID yourself and you don't know it. But if you're wearing a mask, you're preventing others from catching COVID from you. And so there are several recommendations out there for how to make your own mask. You can wear a bandana around your face. You can wear a cloth mask. That there are many patterns out there and YouTube videos on how to make one. Or you can even take an old sock and cut it to create a mask. And we've even created masks using t-shirts. So those are available as well. So if you click on any of those links out there, that will take you to directions on how to make masks. And lastly, if you do need to get tested, if you've been exposed and you've developed those symptoms and your doctor has decided you need to get tested, there are local testing sites in our area providing the testing. So you can find those sites by going out to the governor's website and looking for the nearest location to you, or you can come to the health department. You can come to my local health department. We are doing testing daily. It is recommended that if you're going to get tested that you call in advance. So you do want to call ahead, let them know you're coming, and they have a process that they're going to tell you to follow when you're presenting for testing. So before I open it up to questions, I do have my mask with me. So I'm going to stop the sharing screen so that you could see my face. And I do want to point out the proper way to wear a mask. So I have a mask that I've made. Ideally, you do not want to touch the front of your mask when you're putting it on. You want to always try to handle your mask by using the straps. I've designed my mask so that it goes behind the back of my neck and the back of my head instead of over my ears. But many of the patterns you see will have loops that just go around your ears. So again, you don't want to touch the front like I did, and we'll talk about why in a minute. But you're going to put your mask on. You want to make sure that your mask covers your chin and your nose. And mine even has a wire that you could press down on to make it fit. So you want to make sure when you have your mask on that you adjust the straps so that the sides of your face are covered, the top is covered, the bottom of your chin is covered. And that keeps any air from coming out the sides and coming out the bottom and the top, so that you're not exposing everyone else to your breath where the respiratory droplets are through your mask. Okay. Again, when you take it off, you don't want to touch the front. You just want to touch the strap and take it off. The reason you don't want to touch it is if you've been out in public and you've been around someone who has coughed or sneezed, well, you're kind of defeating the purpose when you take it off and touch it, because until you can get your hands washed, you still have that virus on your hands. So when you use the straps, they're not as accessible to the coughing and sneezing because they're behind your head, and that makes it a little safer. Okay, so I'm going to open it up to questions. Do we have any questions?
I've got a question. I've heard some recommendations about the possibility of wearing gloves. Could you talk a little bit of when might be a good situation for you to wear gloves, or if that's necessary, and who that might be a good option for, please?
Sure. So wearing gloves, that is a good option. What I would recommend is anytime you're going out into public to a location where there's a lot of people. So you're going to, a good example is going to the grocery store. So you're going to the grocery store, there's been lots of things in that environment that people have touched. They may have breathed on, they may have coughed on, they may have sneezed on. Wearing gloves, it just gives you a little extra protection from those surfaces. Again, though, what you need to remember is when you put those gloves on and after you've touched everything, before you get back into your car to go home, you want to take those off by turning them inside out and then disposing of them, so that you're not re-exposing yourself. You've protected yourself by wearing them, but if you pull them off by the fingertips, then you run the risk of touching what you touched in the store.
Thank you. I have another question. I've also heard of some people that after they've been out in public, they'll come home and take off the clothes that they were wearing while they were, say, out at the grocery store and taking a shower before getting dressed in fresh clothes. Is that something that you think is necessary or recommended, or who that might be recommended for?
So if you live in a home where you have someone who is more at risk for the illness, and by at risk, what I mean is they have a existing illness that if they were to get COVID would be aggravated by their existing illnesses. So diabetes is one of those. Someone who has heart disease may fall into that category. Someone who has asthma may be at higher risk to this illness. Then you may want to use more caution coming home after being out in public. And so, the things that you've described, there are additional precautions, and you can do those just to limit exposure to the others in your house to what you may be bringing in from the outside. It is
Thank you.
recommended to, this is something that I and my family do, and it is recommended to do. If you've been to the grocery store like that and you've walked around, take your shoes off, just slip your shoes off before coming into the house. And then that way you've left them outside and not brought in the house what you've walked through at the stores.
I have a question, Robin.
Mhm.
So, how long does COVID kind of stay on certain surfaces? Because I've heard a lot of different things about that. Some things say like 10 days on plastic, and some people say just like a day or two. And I've wondered that about like going back to work and paper. Like we do a lot of stuff with paper. If someone has to sign something, like how like concerned should we be about that, I guess?
So what I always recommend people to do is go out to the CDC website. They have a COVID page and they update it minute by minute. And that is the most current information you could get. There is a listing out there for how long COVID lives on different surfaces. And so if you're interested in that, I would recommend you going out to cdc.gov, G-O-V, and look at their COVID page and length of virus on different surfaces, and that will give you the most current up-to-date information. I will say a lot of our county offices and our health unit, we are wearing gloves when we are handling paper.
Oh, okay.
Just to be safe.
Yeah, okay.
Good question.
Thank you.
I have another one for you, Robin. I was just wondering, we've heard a lot on the news about testing and who should get tested. In Washington County, is it still primarily people who either have symptoms or know they have been exposed to COVID-19 that are getting tested, or are there any opportunities for just members of the community that may be asymptomatic to be tested?
So again, what I will tell you is the list of who should get tested does change, fairly quickly in our world. So again, I would just look out on those websites and see what the current recommendation is. The governor's website that I included in the PowerPoint is a good website to look at. Also, our state website for the health department's a good website. Currently, as of this moment, and I will always say that, as of this moment, what we're recommending is if you are a close contact to someone who has tested positive, if you have been exposed to someone who is positive, or if you have developed symptoms. Those are the categories that we are currently looking at. They are doing some community testing in our nursing homes. So they're setting those up to do some testing. And periodically you will hear on the news where there might have been a case in like a local business. And so we've gone in and done community testing there. But testing is being done. So if you feel you need to be tested, I would contact those local providers and talk to them because they have a screening criteria that they're going to follow. And if you meet that criteria, they're going to tell you come in and get tested. And again, my local health unit is testing daily. So you can even call our number, which is 479-521-8181, and ask to be tested. And they're going to go through that criteria with you.
Thank you very much.
Thank you.
And I have another question. So also, I've seen a lot of stuff where when you go to the grocery store, you should sanitize your items after you get home. Do you suggest that? I've seen a lot of just different back and forth on all of that stuff saying don't do it, or you should do it, or what do you suggest?
My suggestion is if you are concerned, you've got someone in your home whose health is greatly at risk to COVID, I would say it doesn't hurt doing that. It does not hurt to do that. If you are afraid by not doing that, you're going to create a greater risk for everyone around you, just do it. there's no harm in that. There's no harm in doing it.
Okay.
I often get asked lots of questions about social distancing now that some of the restrictions have been lifted. You know, can you go back to having family gatherings? Can you go back to having friends over? At this point, I would encourage you to be cautious. Be cautious about that. If you choose to do that, you know, you need to make sure you have a large enough space where people can be, you know, 6 feet apart and not be in be in an enclosed environment where close contact puts you at greater risk. I do understand people want to see each other and be with family, and I get that too, but I think it can be done where we can be safe. And again, we are highly encouraging you to wear a mask even in those situations.
So you suggest wearing a mask even, let's say you're outside on your back deck with 2 or 3 friends and you're 6 feet apart. You would suggest wearing a mask still?
In those situations, I believe they are saying because you're outside and you're 6 feet apart, you are safe. It's
Okay.
You just need to be mindful of staying 6 feet apart. You need to be mindful of that. And if you choose to go inside the house, you have to be mindful of the fact that now you're in an enclosed environment and you may want to put a mask on
Okay. And wash your hands.
and wash your hands. I know. It's hard. It's hard.
So in general, is it safer outside than it is inside?
You know, I almost hate to say yes or no to that question because I do know that we're still learning about the virus. I do believe that if you look on the CDC website and they talk about gatherings, they do stress being outside, being safer. So I would suggest that if you're going to have a gathering, that you look at the most current information, pull up that CDC website, see what they're suggesting, because it does change rapidly. And I want to give you the best information. So my answer will be, you know, go and research it before you have an event and see what they're suggesting for that moment in time.
And why is it that it's safer outside? Is it like the UV rays from the sun? Is it like has to do something with the heat or?
I think it's because outside, and I'm not a scientist, so you know, I think, and this is my from what I've gathered from reading the websites, is if you're outside, you're not in an enclosed area, and it's easier for you to not come in contact with a surface that someone had maybe breathed on or sneezed on or coughed on. Again, though, if you're sitting outside and you're 6 feet apart and someone coughs and you walk into that mist, well, then you've been exposed. So we all need to be mindful of using proper precaution when you cough or sneeze. You know, do the elbow cough and sneeze every time, or turn away, or be mindful which way the wind's blowing. But we need to protect each other, and that's the main message: is be aware that you could have symptoms and not know you have symptoms. So wearing a mask is protecting others from you.
Right. Okay. Yeah. Yeah, I've noticed on the Greenway when I've gone to walk or be on it, there are just so many people, and it kind of makes me nervous. And I've kind of wondered, like, how long does it, which you probably could find this on that CDC website you mentioned,
Right.
but how long does it linger in the air when I'm walking behind people, or if I'm riding my bike and I go around someone, or, you know,
Right.
it's a
Right.
strange thing to think about.
It is, and I use the Greenway Trail a lot myself. We just try to make sure that if we're coming up on a group of people, either riding or biking or running, that we give ourselves plenty of room, you know, between us and them. And you do think about that if you see someone coughing, because allergy season is out there, so you
Yeah.
get outside and you're going to sneeze and you're going to cough because of the allergies that are out there. So you just have to give each other a wide space so you're not in that 6-foot radius.
I've got another question, Robin. So Corey and I have both returned to work at the library. We're working shorter shifts than usual, but it's felt very different for me going back and being in a public building for 3 or 4 hours versus just running to the grocery store. Are there any additional precautions that need to be taken when you're out in public for longer? Or is there anything extra that you can do to try and be safe?
So what we've suggested to businesses is that their employees wear masks to work. So you're going to wear a mask to work, especially if you're coming in contact with the public. We have done some things to create barriers, and I know you've probably seen those in the stores that you have gone into. But if you have a counter where you're assisting the public, that you create some type of a barrier so that you're protected if someone is coughing or sneezing. And there's some simple do-it-yourself ways of doing that. I've seen different methods, but it just creates another protection between you and the person you're assisting. And in the library, if you're assisting a patron on the floor or look for a book, just maintain distance. Wash your hands. If you've touched surfaces, make sure you've got some hand sanitizer or the ability to go and wash your hands after interacting, with public areas.
Thank you. Well, I think that was all the questions that I had, Robin. Thank you so much for answering them. Corey or Linda, did either of you have some questions for Robin?
No, I don't have any questions.
No, I don't really have any anymore. That was all my questions. Yeah.
Well, again, I will stress things do seem to change on us rapidly. So for the most current information, just make sure you're checking those websites to see what's being recommended, before you have an event or before you go out in public, or you're returning to work, or you're returning to some of these other events that we have in our lives, and follow the guidelines and stay safe.
Thank you very much, Robin. Thank you for all the great information and for your time. I really appreciate it.
Thank you. I appreciate the opportunity.
Thank you.